Welcome to Business Unleashed, a Plano Chamber Podcast, presented by Baylor Scott White Plano. We're honored to have Dr. John Marcucci, Chief Medical Officer at Baylor Scott White Plano, joining us to discuss a groundbreaking breast reconstruction procedure known as the DIEP Flap. This procedure offers incredible benefits for women who have undergone mastectomies using the patient's own tissue to reconstruct the breast. Dr. Marcucci will guide us through how the DIEP Flap works and why it's a preferred option for many breast cancer survivors and the resources available at Baylor Scott White Plano. We're so excited to have Dr. John Marcucci, Chief Medical Officer on the medical staff at Baylor Scott White Plano. We're here to discuss an important option for breast cancer survivors, the DIEP Flap breast reconstruction procedure. Dr. Marcucci has a ton of experience, I think over 20 years of experience, and we're so excited to speak to you today about what Baylor Scott White is doing and what you are doing to increase breast health and help women in the Plano area and in the DFW area, period. So Dr. Marcucci, welcome to the podcast. We're so excited to have you back. And let's just dive in and, explore what the DIEP Flap is and, tell us a little bit about your background at Baylor Scott White.
Sure. Well, thank you for having me. It's a pleasure to be here and talk to you today about our DIEP Flap reconstructive surgery program here at Baylor Scott White Plano. I am John Marcucci. I'm the Chief Medical Officer here at Plano. I've been the Chief Medical Officer for 12 years now. We are about to celebrate our 20th anniversary in Plano. We opened on December 1st of 2004. So we've been part of the Plano community for 20 years and 20 years strong and continue to grow, and very excited about that. And I'm fortunate enough to be part of the Plano campus since before we opened. I started off I'm an emergency medicine physician. I started off as the emergency department medical director back in 2004 up until 2012 when I moved into the chief medical officer role.
Wow, that's amazing. That's really amazing.
So thank you. Just to talk a little bit about our program here, what we've done in the last couple of years is really developed our reconstructive program for breast cancer survivors. We have two amazing plastic surgeons and an amazing group of breast surgeons and oncology surgeons. And one of the newer procedures is the DIEP Flap reconstructive procedure after mastectomies. And the DIEP, it's actually DIEP, the deep inferior epigastric perforator procedure. And that is named after the blood vessel that runs through the abdominal muscle that is part of the reconstructive process. And so we just kind of shorten it up and we just call it a DIEP Flap. The traditional surgery for reconstructive breast surgery is the tram flap, and that's pretty much accessible, and almost any reconstructive surgery center will do those procedures. But that older procedure actually takes a part of the abdominal muscle and reconstructs the breast from the muscle and the tissue of the abdominal wall. The DIEP Flap only takes the skin and fatty subcutaneous tissue and retains the abdominal wall muscle, retains the strength of the abdominal wall, and gives a more natural feeling and appearing reconstruction. And it also is kind of like a little tummy tuck because it's actually taking abdominal fat and skin and using that to reconstruct the breast.
Wow. That's really interesting. I mean, from, patients that, go through this typical, type of procedure.
Right.
And I think it kind of restores their confidence, in so
Absolutely.
many different ways. Yeah. So,
Absolutely.
yeah. So you talked about, some different methods that, have been developed over the years. What are some of the main benefits to using, to having the DIEP Flap versus the other flap that you mentioned?
Right. I think one of the most important features is the retention and of the abdominal muscles. Those stay in place, so there's virtually zero chance of developing an abdominal wall hernia that is sometimes a complication of the traditional tram flap because we're actually taking muscle away from the abdomen. This restores or retains that muscle within the abdomen and retains that abdominal strength. Also, the tissue and the tissue is more natural in the reconstruction than the traditional muscle, using a muscle to restore tissue. The other thing that I think is unique about our program is that oftentimes our surgeons, part of the process in reconstructing this is the skill of the plastic surgeon, right, in doing a lot of microvascular and microvessel reattachment to maintain blood flow into the transplanted tissue. And part of doing that, also our surgeons also, if appropriate, will do a nerve graft to help retain sensation and sensory into the reconstructed tissue as well.
Nice, nice. So you work with several physicians that can refer patients to just kind of make an informed decision about their breast reconstruction options. So how does that usually work? Does can they say, okay, I want to have this done, or is that more referred to them by their physician, or yeah.
So part of our program is all of the above. That's what we're trying to do. We're trying to allow patients that are interested in getting an opinion of whether or not they're candidates for the surgery to self-refer themselves into our program. Also, primary care doctors, breast surgeons, and the plastic surgeons as well are all avenues where patients can get in. Our plan and our desire for the program is to make it easy for patients to get navigated through, to get referred in, be able to self-refer in, get an evaluation by one of our surgeons, our reconstructive surgeons, to explore the options for them for each individual patient. Right? It's not everybody's a candidate, but everybody deserves to be, look at all the options available to them so they can choose the best procedure for them.
Absolutely, absolutely. And that's really good because you're not being a barrier
Right.
in any
Right.
kind of way to the patient, getting what they need. So what kind of resources or support, does Baylor Scott White Plano provide to breast cancer survivors who are considering reconstruction?
Absolutely. So we've developed over the last year a comprehensive program from referral in to post-operative care, and all of the above. So we are streamlining the process for preoperative education. So patients can come in. We want them to come in and learn about the procedure, learn about what to expect during your hospitalization, what surgery day will look like, what your hospital stay will look like. And we can go into those details if you'd like. But so a preoperative class, we get you in. We work with our access services team to make sure that we've gotten all the pre-authorization and all the, go through all the insurance barriers. We've tried to streamline that process as well. We have a preoperative evaluation or a pre-admission testing clinic where you'll see a doctor. Preoperatively for medical clearance, any preoperative testing, we've streamlined that process as well. And then post-discharge, we've worked with our Baylor Institute for Rehab for your inpatient recovery therapy, so physical therapy and occupational therapy in the hospital. And then we've standardized the post-discharge rehabilitation as well. And the program for any of our outpatient rehab centers, you'll have the same recovery program when you leave the hospital, and knowing what your next steps are. And then we have a really impressive, comprehensive cancer program here at Baylor Scott White Plano, where we have survivorship classes and survivorship meetings and therapies and fit steps programs and exercise programs in our cancer center and our medical office building. So we do have a very holistic and comprehensive approach to caring for our patients.
That's really good, because it's all about community and just being
Absolutely.
informed about, the different options that you have. So, and speaking of being informed, like I'm sure, you hear like different things, like different kind of misconceptions of, the word, oh, I heard this and this, that, and the other. What are some common misconceptions that you've heard, or what are some ways that you can address concerns that people may have about the deep flap procedure?
Sure. I think there's there's the biggest misconception is that mobility will be impaired or I won't be able to do what I did before.
Mm.
And that I think is a common misconception. And I think part of the advantage of the deep flap in that reconstructive process is it does allow you the ability um, to maintain function, um, be able to do the same activities you did before, and really do that. And we have, one of our employees is a breast cancer survivor, and she went through the deep flap. And anecdotally, she likes to show people that she can do jumping jacks, and alleviate people's concerns. And she's like, "See what I can do."
Hmm.
And so it promotes, restores confidence, restores physical appearance, and it's just a really amazing confidence booster. And seeing patients come through the other side and just finally putting cancer behind them, and getting on with their lives back to the way they were.
Hmm. And I think that's so important because, that I know, like my mom was diagnosed with breast cancer. I have several aunts that have battled with breast cancer. And the biggest thing that they, always wanted was to have a sense of normalcy and that they felt like their life was moving in the direction that, it was pre, breast cancer. They always wanted to, to feel, like
Yeah,
they did before, and to not feel
absolutely.
like it took anything away from them.
And it's unfortunate how common breast cancer is. Um, but the other part of it is, when you receive any kind of cancer diagnosis, um, everything stops after that, right? And
Hmm.
so trying to navigate through what do I do next, that's what we want to take away. We want to lift that burden off of patients. We want to focus on getting them through the medical procedure, taking care of their emotional and physical and um, emotional well-being as well, right? With our
Hmm.
survivorship classes, and groups and those kind of things, and the psychology services we provide. Um, we want to take care of all of them, and we want them to focus on themselves and getting better, and getting through, and not have to worry about who do I call to make my next appointment, or how do I coordinate care between my oncologist, my breast surgeon, my plastic surgeon. We want to take that burden off of you, and we want to make it a very smooth process, and we want to help get patients through, and take that burden off of them.
Yeah. So what advice, like if we have someone listening like right now and they are currently facing a decision about breast reconstruction, what advice would you like give them if they're, listening right now to us?
I would say, there's multiple things. I would say talk to your doctor. If you already, I'm sure, if you're already in the middle of treatment, you have an oncologist that you're seeing, or a breast surgeon that you've seen or talked to. Talk to them. Ask them about the options, and about the program. If they're in the Plano area, I'm sure they're familiar with our program. They can self-refer. They can call our clinic number and refer themselves in if they want to be evaluated and come into the program themselves and just explore what's out there. But I would say first thing, probably talk to your doctor and ask them about what their options are.
That's good. That's good. Well, that was great, Dr. Marcucci. So let's dial back and kind of go through. like the typical day and preparation to the day for your DIEP Flap, and maybe some of the information about like recovery and, all of that, how long you stay in the
Sure,
hospital, that kind of thing.
absolutely. So sure. So they're long surgeries. They can take anywhere from 6 to 8 hours. We typically will do no more than two in a day at the hospital here. On day one is surgery day. You'll come in the morning of surgery. We don't admit patients the night before, so you'll come in the day of surgery, and then that first couple of nights, 2 to 3 nights, will be spent in the ICU with recovery. And, the nurses will keep a very close eye on the reconstructive tissue. They'll do Doppler ultrasounds to make sure blood flow to the flap is consistent and stable, and everything's going well. As day 2 to 3 approaches, physical therapy will start getting involved. We'll get you out of bed probably the day of surgery. Up and walking, mobility is key to recovery. So we don't let you just lay in bed for 4 to 5 days. We get you up and walking and moving around. But physical therapy will get involved very early on in your stay. Again, 2 to 3 nights will be spent in the ICU, and then patients will move into our seventh floor into our med surge unit for an additional 2 days. So hospital stay total of about 5 days. We'll start again the physical and occupational therapies in the hospital, and then we'll transition that to our standardized process, our standardized rehab plan in an outpatient way. And so that'll take about 6 to 8 weeks. And then after that, depending on the surgery, there may be additional smaller surgeries for cosmetic kind of surgeries,
Hmm.
nipple reconstruction, and some other minor surgery procedures down the road after recovery. But typically that's it. So about 5 days in the hospital and about 6 to 8 weeks of recovery. Um, Again, we do two of those a day because they're long surgeries. Two
Hmm.
surgeons will be in the operating room performing the procedure and the reconstruction for if both breasts are being reconstructed. Um, Usually both of them, are working together in tandem for each case. We are we have a great process where the whole hospital's engaged around our deep reconstructions, right? They're not emergency surgeries. So we're able to plan for them, plan for the hospital stays, and plan for the number of patients that we have. And we are, every other month we will have a full week of cases, Monday through Saturday. So we'll do
Hmm.
12. We're planning to do 12 cases every other month, and then 2 cases on every Friday thereafter. So we have the capacity to do over 150 patients a year.
Wow, that's amazing. That's amazing. Before we can, even get to a
Get to the,
conversation about the deep flap, what are some things that women should be doing, not yearly or, every 6 months for some women in some cases, to take care of our breast health?
Absolutely. So honestly, in an ideal world, we wouldn't have to do any of these reconstructive
Hmm.
surgeries, and that's clearly putting us out of business would be a great thing. To prevent cancer and cure cancer in a way that doesn't require surgery at all, obviously, is our long-term goal, and we're unfortunately not there yet. But
Yes.
absolutely everybody that's eligible should be getting annual mammograms, um, and making sure that you're doing self breast exams at least monthly. When you're in the shower, take a few minutes. Every woman knows their own body and knows when something's just not right. And if something doesn't feel right, get it checked out. And absolutely continue on with your breast cancer screening. If you have a strong family of history of breast cancer with, primary relatives, so your first degree relatives, so moms, aunts, cousins, sisters, siblings. Um, Talk to your doctor about that. You might be eligible for genetic screening and counseling
Mm-hmm.
to see if you are a carrier for there are certain cancer genes that make some women more susceptible to breast cancer than others. So if you've got a lot of family history of breast cancer, I recommend you talk to your primary care doctor about genetic screening, genetic counseling to see what your options are preventative wise for cancer. But primary thing is get your mammograms, get screened annually, do self breast exams, know your body and know when something's different and get help early. The earlier we can intervene with breast cancer, the survival rates. Unfortunately, we talked about earlier that unfortunately a large number of women will be diagnosed with breast cancer. The good news is that we're catching it earlier and we're
Yes.
doing a much better job and we're curing it more than we ever have. So early detection, early intervention is key to survival.
It is. And if you haven't done that, do it. Make the appointment. Call.
Absolutely.
Go online.
Absolutely.
Make the appointment today.
If
Absolutely. So,
anything, if
mhm,
anything, that's my big take home message is make sure you
mhm.
get your screening, especially.
Yes, absolutely. So if someone says, okay, Dr. Marcucci, I'm ready. I want to learn more about the deep flap, and I want to make an appointment or talk to somebody about it. How do they do that with Baylor Scott White Plano?
Absolutely. We are working on a website that we have not launched yet, but that will be forthcoming. And you'll be able to find it on our Baylor Scott and White Health, bswhealth.com website. And the Plano location, that's in the future. But right now, what is available is a phone call to our clinic to talk to somebody and make an appointment. And that number is 214 814 2548. Anybody's welcome to call, speak to somebody, and we will get you referred to the right place.
Thank you so much. This has been a great conversation. And I just want to thank you for, being here with us and sharing this information with us because it's been really good and helpful. And I know for a fact that someone is listening that, can use this and, not only use it for themselves, but maybe pass the word on, to someone else that can possibly, change their lives. It's really, really good. Yeah, very, very good.
Thank you. Thank you for having me. It's been a pleasure to be here. And just for anybody that needs us, we're here. Um, we're here to serve. And what I think we're doing really well at Baylor Scott and White is helping patients get through the journey of healthcare and giving them options and opportunities to navigate themselves through and really guide them through the process and make traversing the healthcare journey much easier.
Absolutely. And again, if you need more information on the Deep Flap program, please call 214-814-2548 for more information. And thank you, especially thank you, Dr. Makuchi, for being here. And thank you for Baylor Scott and White Plano for sponsoring this podcast. And so I think it's really special to have you on. And like I said, we look forward to more conversations in the future.
Thank you. It's been a pleasure.
That brings us to another end of an insightful episode of Business Unleashed, a Plano Chamber podcast, presented by Baylor Scott and White Plano. A big thank you to Dr. John Marcucci for sharing his expertise on the deep flap and for the crucial work Baylor Scott and White Plano is doing to support breast cancer survivors. As we continue to raise, I want to encourage everyone, whether you're a survivor, supporting a loved one, or just staying proactive about your health, to prioritize your annual mammogram. Early detection saves lives, so if you haven't done it already, make an appointment today and encourage your women in your life to do the same. For more information on the Deep Flap program and other breast cancer resources at Baylor Scott and White Plano, call 214-814-2548. That's 214-814-2548. Thank you for listening, and don't forget to subscribe to Business Unleashed on your favorite podcast platform. Until next time, stay healthy, stay informed, and keep unleashing your business potential.